Hi, everybody. Welcome to the AGH Sports Medicine Back in the Game feature with Pittsburgh Sports Report. I'm your host, Ellis Cannon. We're joined today by Dr. Darren Frank of AGH Sports Medicine. We're talking about ACLs. We all hear about them all the time. How about we have Dr. Frank explain them in greater detail for us? Doctor, a pleasure. Thanks so much for being here. First and foremost, what is the ACL?
Well, the ACL is one of the four major stabilizing ligaments of the knee. So you have two on the outside. Those are called collateral ligaments. The ACL actually stands for anterior cruciate ligament, and it's a cruciate ligament because it forms a cross with the PCL, or posterior cruciate ligament, in the central portion of the knee. Now, the ACL's role in life is to keep the tibia or shin bone from sliding forward underneath the femur or thigh bone. The ligament itself is, you can think of it as a rope that sort of anchors the two bones together. It's made of ligament, and ligament is a tough cord-like structure that serves its function as a rope or stabilizer of the knee.
Now, are athletes more prone to this than, let's say, the average Joe?
Yeah, I mean, it typically takes some force to tear the ACL. It's a very tough ligament. It's a tough structure within the body. So athletes put their bodies under tremendous stress, and particularly the knees, which are relatively unprotected in most types of sports. So athletes are definitely more prone to this type of injury than the everyday person.
What does data suggest, Doctor, when it comes to both sport and gender relative to the frequency of diagnosis when it comes to the ACL injury?
Sure. The data in the literature in sports medicine shows that female athletes are actually 8 times more likely to rupture their ACL than are male athletes.
Now, why is that the case?
Well, nobody really knows, but the athletes, typically female athletes, will jump and land a little bit more differently, so there's been research focused on that. There's also been some focus on the hormonal changes that women undergo on a monthly basis as opposed to men.
Doctor, you're an orthopedic surgeon with AGH Sports Medicine, but I want to ask you, do you see this more frequently in an acute setting like we often see when we watch players in a football stadium, or is this the type of thing that could occur more gradually over time?
It's usually acute. When the knee becomes unstable, a patient or athlete will know it. They'll typically come in with a very classic story: a turn or a pivot or a deceleration type injury. They sometimes report feeling or hearing a pop in the knee, sometimes a burning or hot sensation within the knee, and then subsequent to that they'll get swelling, which will subside over a period of time, and then the knee actually feels unstable. They'll complain that when they step or make a turn, it will buckle and turn out from under them.
And I'm sorry.
So it's usually more acute than chronic.
And that's the feeling that we get to the extent we have a knee injury where we just feel, as you pointed out, less stable and the knee's about to give way. Diagnostically, talk about the differences in the roles of traditional x-rays as opposed to MRIs.
Sure. Well, the examination of any athlete or any patient for that matter includes taking a careful history and then a physical examination. These injuries are sometimes difficult to pick up on physical exam, at least acutely, because the patient is apprehensive. They have pain, they have instability, and something's wrong in their knee. They don't want you to manipulate it. But if you're very careful, you can pick up the differences in stability or laxity between one knee and the other. In terms of X-ray and MRI, X-rays are great for looking at bony injuries. So we'll get a screening set of X-rays, make sure that the injured knee is not fractured. There are some subtle things on the X-ray that you can sometimes see that will suggest an ACL injury. MRI is a very valuable diagnostic tool. It lets us look at soft tissue, cartilage, ligaments, those sorts of things. So an MRI is good for me as a clinician, not only to confirm my clinical suspicion of an ACL tear, but also to evaluate for concurrent injury to the other ligaments in the knee, the articular or joint lining cartilage, or the shock absorbing cartilage such as the meniscus.
You mentioned moments ago the breakdown between gender and sport. Do you see a difference in terms of age as time goes on in your practice relative to whether or not we're seeing more or less with younger athletes, for instance?
Well, I think the incidence is pretty much the same in younger athletes. What I do see is I see people in their 30s, 40s, and even 50s rupturing their ACL. And the reason for that, that's a function of people just remaining more active further into life. And so I do see it in those patients as well as the younger patients.
I want to ask you, as it relates to the treatment in a generic or general sense for a moment. Oftentimes we hear, as you pointed out, about swelling. You'll see athletes that sustain these injuries have a period of time where they let the swelling go down. They'll use crutches and then ultimately reconstructive surgery. Is that generally a pretty good assessment?
Yes. So, for a patient to be a candidate for surgery, if they elect to have their knee treated surgically, usually we like to optimize the function of the knee going into the surgical procedure. And what that means is let the swelling go down and normalize, and then normalize their motion as well. With any surgery that you do on a joint, stiffness is always a concern post-operatively. So we like to optimize things going in so that the outcome is optimal at the end.
2 points on rehab. Talk generally about how rehab goes from the ACL injury and the treatment you just described. And is it evolving over time? For instance, it appears as if that we're seeing greater return quicker from athletes. Is that in fact the case?
It is. I mean, when you go back 20 years or so in ACL reconstruction, people were in a cylinder cast for 6 months postoperatively. What we found is that joints in general do not respond well to being stiff. So our focus within the last 10 years has been getting knees moving more quickly, and then focusing on the agonist muscles, those that within the leg, those that help the ACL. With any ACL reconstruction, the most important, or really the rate limiting step, is return of motion, but most importantly, the incorporation of the graft. So when we put a graft in for an ACL, it needs to incorporate. It needs to become one with the person. It needs to grow, and that period takes a period of time, typically between 6 and 9 months. So that's really the limiting step, and most athletes are able to return at the quickest point at 6 months postoperatively.
Okay, and what is that success rate generally in getting players back out on the field?
Across the board, ACL reconstruction is very successful. The success rates are in excess of 90% return to sport.
I've mentioned to you, and I did before we had our conversation right now, that back when I was on radio and television every day, I would talk a lot about how it seemed to me that there were players that seemingly from the 50s had these, but we never talked about them. Was that in fact the case?
Well, I think it probably was the case. I don't think this is a new injury, but with a lot of just like a lot of injuries, they're more recognized. We have better diagnostics to recognize these things, and more importantly, we have better treatments. So, with an operation that has a 90% success rate across the board, there's no reason for an athlete to walk around with a hobbling knee or an unstable knee when in 6 to 9 months' time we can get them back to nearly their native state.
Thank you very much, Doctor. We appreciate your description and analysis. Look forward to continuing to work with you. Thanks. That's Dr. Darren Frank. I'm Ellis Cannon. You've been watching the AGH Sports Medicine Get Back in the Game, presented by Pittsburgh Sports Report. I'm Ellis Cannon from Pittsburgh Sports Report and PittsburghSportsReport.com.